Hello, I'm Dr. Andrei Kulish. For some reason, we are getting quite a bit of inquiries recently pertaining to identification of toxins and detoxification of children, specifically autistic children or children with delayed development. Presumption being that if they are delayed, that then there must be some offending factor that causes this delay, which may or may not be the case. And incidentally, I agree that looking for toxins in children with delayed development, autistic or otherwise, it's a very good idea to remove them if there are any, for that matter. There are several tests that pertain to toxins, to identifying toxins in organism. One of them that is pretty common and is generally used as a hair test. Well, it's not that I don't have any hair, that's why I don't like it, but it is simply that hair is very easily contaminated, and the results of the test are coming with those extra contaminants. How they are contaminated? Well, I have some notes here. They are contaminated by chlorine, by fluoride, by shampoo, by hair treatment, all the sprays that women put there, and by environments, by other elements of environment like car exhaust, smoke, cigarette smoke. Generally, a lot of stuff that is around us is in the hair. Example, if somebody is not a smoker and goes into the room that there's a lot of smoke, cigarette smoke, comes out 5 minutes later, then the hair smells like a smoke. So if person went to a test, to hair test, 6 weeks later or 2 months later, then it would be that person is a smoker, while in fact the person is not. So be aware that hair test is very easily contaminated, may not be true. If something comes out of it that is alarming, take a chill pill. I think that everything will be fine. Do the test again or just do the different test. The same applies to bioresonance. And the bioresonance has the same environmental errors as hair test does, simply because people are being tested in their street clothing that is full of elements from the environment. And bacteria, mold, viruses, chemicals, car exhaust, it's perchloroethylene that is a substance that is used in dry cleaning shops. It's probably also some residual. So if you are getting from bioresonance stuff that really puts you on edge, cool down. Probably there is more on it than it really is in the body of the patient, in the organism of the patient. So it's very important to retain some common sense to it. The test that I like the most is urine test, and urine test is instant. Is as of today, takes about 24-hour urine collection. It's a very specific way to do it. The lab is going to tell you if you decide to do it, and then you will get quite a bit of information, particularly on heavy metals, through extraction of porphyrins. Porphyrins are the elements that are part of our metabolic process that are being released, and the combination of porphyrins and their relationships may actually tell you how much of heavy metals are in the organism of a child. So this is one that I like. It's easy, it's instant, and instant as of today, I mean, and also it's non-threatening. While there is another test that I like, but it's very threatening to children, very stressing to children, is blood test. I don't use it simply because I don't like to stress children. I know how useful this test can be, but little children have enough of stresses. I don't like to stress them anymore. But here's the thing, that when you are getting a test, whatever test it is, if results are coming really very alarming, do not get alarmed too much. Do another test. Go to a different lab. Go and do another test and find out. Most likely there's going to be a lot less alarming results than in the first test. The second thing is that you need to test your drinking water, because drinking water can be a major source of contaminants, and this can be it's tons of stuff. Once again, it's a chlorine, it's fluoride, antibiotics, fertilizers, Fecal bacteria, yes, there is quite a bit of them. Staphylococcus fecalis, for example, coliforms, E. coli, all those things can be in the water. So test water, find out what's in it, and if there is anything like it, put a good quality activated carbon filter on it, or some other filter that is really going to remove all those toxins and those contaminants, and then you are going to find out that after 6-8 weeks of drinking this really clean water, you are going to find out that whole family will feel better. Now here is case in point. A lot of people are using bottled water as a clean water. Well, it's not always the case. The spring water that is on a label of very many bottled water is just the tap water run through filters, and we really don't know how good those filters are and what is the quality assurance there. So put your own filter and make this little expense. By the way, we don't do filters. We don't tell people what brand of filters to take. We are not associated with filter industry. We simply know that filters work. So the second thing is that when you are testing physiology of autistic child, when you are testing toxins in autistic child or delayed development child, remember that metabolic and physiological processes of little children are incredibly dynamic. So if something doesn't seem to work now, probably wait 2-3 minutes, 2-3 hours, I mean, and you are going to find out that everything will probably be fine. Now, when it comes to other tests, well, you see, this is not about how a child is tested or what kind of test you are doing. The most important thing is that how you are going to use it and what you are going to do to detoxify child from those toxins that have been found. So this is very important thing that you have to work with somebody that will be. I'm sorry, I'm looking here to the right because I have my notes here on the screen. And it's very important to understand that there must be some regimen, some protocol to detoxify child from all those things. Now there is one more thing, that very many tests can be contaminated substantially by the medications that child may be taking. Or person may be taking that wants to do the test. So if you are doing blood test or porphyrin test, be aware of the fact, particularly those two, that their results may be substantially skewed by chemical substances of which medications are made. So specifically when it comes to sedatives, analgesics, antibiotics, particularly if a person has anemia and liver disease, this can actually substantially alter the test, specifically porphyrin test. So be aware of it. Other than that, a lot of people are testing stool. A lot of people are testing sweat even for toxins. I'm not quite sure if this is the really right way. Folks, we live in the environment that is toxic from day one on Earth. This is not that we have fresh air and fresh water and all this stuff. We generate ourselves a lot of toxins. Our metabolic and physiological processes generate toxins. That's why we go to the bathroom once a day at least and we poop. We get rid of all the toxins that we created through the digestion and metabolic processes of our food. The same applies to urine. So this is really something that is very, very important to keep in mind, that we are a generator of toxins ourselves, and then we have a system that is removing it so we can actually live healthy lives. Now the thing is that you may actually go through a number of things that are not going to work. If this is the case, then look at parasites, and you may actually talk to a doctor or practitioner that is experienced with parasites and look into it, because this may be that the child or the person that is testing for toxins may actually host quite a bit of parasites, and once again, this needs to be taken care of. There's asterisk here, a sidebar, so to speak, that some parasites can have parasites in them. So this is kind of a double whammy. It's very important to keep it in mind. So if something doesn't really work, then look into parasites. How to detox? Well, the best way to detox is some form of chelation. Little children don't do chelation very well. Older children may or may not do chelation through IV. I don't like those things done to children simply because it's stressful. So I prefer to do it through food. I prefer to do it through ways that are more natural, and they can be very effective. It will take probably about, I don't know, 4 or 5 months, half a year perhaps, but it can be very effective. And other than that, that's pretty much it. I have no specific no specific advice other than just keep it in mind, keep your gastrointestinal tract functioning well, and enjoy life and support your liver. So that would be it. Thank you very much for listening. I'm Dr. Andrei Kulish.